Hello everyone. Today, we're diving into the world of a medication called gemcitabine, commonly known by its brand name, Gemzar. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Gemcitabine, often recognized by its brand name Gemzar, is a chemotherapy drug that falls under the category of nucleoside analogues. It works by inhibiting DNA synthesis, which prevents cancer cells from growing and multiplying. Initially approved by the FDA in 1996, it's primarily used to treat various types of cancer, including non-small cell lung cancer, pancreatic cancer, bladder cancer, and breast cancer. Gemcitabine can be used alone or in combination with other chemotherapy drugs to enhance its effectiveness. Its role in cancer treatment is to slow down or stop the growth of cancer cells, thereby helping to control the spread of the disease. Warnings: Gemcitabine comes with its set of precautions. It's not suitable for everyone, and its use should be carefully considered in patients with certain medical conditions. Patients with liver or kidney problems, heart disease, or a history of bleeding disorders should inform their healthcare provider before starting treatment. Gemcitabine can cause myelosuppression, a condition where bone marrow activity is decreased, leading to fewer blood cells being produced. This can increase the risk of infections, anemia, and bleeding. Regular blood tests are necessary to monitor blood cell counts during treatment. Before taking this medicine. Before starting gemcitabine, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug. Patients with liver disease, kidney disease, or heart disease should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider, as gemcitabine can harm an unborn baby and may affect fertility. Regular monitoring of blood counts and organ function is advised during treatment. You should not take gemcitabine if you have a known hypersensitivity to the drug or any of its components. It's also important to inform your doctor if you have any existing infections, as gemcitabine can lower the body's ability to fight infections. If you are scheduled for surgery or dental procedures, let your healthcare provider know, as gemcitabine can affect blood clotting. Side effects: all medications can have side effects, and gemcitabine is no exception. Common side effects include nausea, vomiting, fatigue, fever, and flu-like symptoms such as headache, muscle pain, and chills. These symptoms are often manageable with supportive care and medications prescribed by your doctor. More serious side effects can occur and require immediate medical attention. These include signs of infection, such as fever, chills, sore throat, and shortness of breath, severe allergic reactions, such as rash, itching, swelling, and difficulty breathing, unusual bleeding or bruising, and signs of liver problems, such as yellowing of the skin or eyes, dark urine, and severe stomach pain. Gemcitabine can also cause serious lung problems, including interstitial pneumonitis and pulmonary edema. Symptoms of these conditions include difficulty breathing, cough, and shortness of breath. If you experience any of these symptoms, seek medical help right away. Interactions: gemcitabine might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Certain drugs, such as blood thinners, other chemotherapy agents, and radiation therapy, can interact with gemcitabine, potentially increasing the risk of side effects or reducing its effectiveness. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking gemcitabine. The dosage and schedule depend on the type of cancer being treated, the patient's body surface area, and overall health. Gemcitabine is typically administered intravenously over 30 minutes, once a week for up to 7 weeks, followed by a week of rest. Subsequent cycles may involve fewer weekly doses. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. Always ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid: while on gemcitabine, it's advisable to avoid exposure to people with infections, as your immune system may be weakened. It's also wise to avoid activities that could lead to cuts or injuries, as bleeding may be harder to control. Given the potential for fatigue and dizziness, it's recommended to avoid driving or operating heavy machinery if you feel unwell. Additionally, it's best to limit alcohol consumption, as it can exacerbate liver problems. FAQ. Many wonder about the age restrictions for gemcitabine. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of gemcitabine, commonly known as Gemzar. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.